Welcome to my presentation titled Impact of Healthcare Reform on the Healthcare Industry. My name is Keela Herman, and this is for Health Information 2012 Spring Semester with Professor Marie Trabick. During this presentation, I will discuss America's past and previous attempts to reform healthcare, healthcare reform under the Obama administration, healthcare reform under the Trump administration, and then I will summarize my findings. I will also include references. Americans received health care in their homes prior to the Great Depression. There wasn't any government oversight, and people paid for what they could. As the medical field advanced during the 20th century, new treatments and better treatment options became available. However, many people could not afford the latest developments in medical care, so treatment was handled by social welfare agencies. During the Great Depression, government leaders began to consider the needs of the poor. The Depression made it difficult to afford medical care for all but a few American citizens. The people who managed to remain employed purchased prepaid health care plans, but the unemployed could not afford to do the same and needed help from a different source. The Democratic President Franklin Delano Roosevelt and his administration were more willing than administrations before him to involve the federal government in managing health care. Though bills regarding pensions and unemployment had been introduced, President Roosevelt created his own programs and appointed a committee on economic security to study the issue. The Social Security Act was passed in 1935. Several amendments were made to the Social Security Act in 1965. The creation of Medicare and Medicaid greatly changed the way healthcare companies are reimbursed. Medicare is a federal program that provides medical benefits for people aged 65 and older. Medicaid is a program that was established to support medical care for the poor. Today, Medicaid is a federally mandated program that provides medical benefits to low-income individuals and their children. Many changes and enhancements have happened to Medicaid since it was enacted in 1967. Medicaid provides federal funds on a cost-sharing basis to states to ensure welfare recipients are guaranteed health care services. During the 1970s, 1980s, and 1990s, healthcare technology progressed and costs continued to soar. During the 1990s, Hillary Rodham Clinton, who was at that time First Lady, unsuccessfully tried to introduce healthcare reform. President Bill Clinton appointed Mrs. Clinton as head of the task force on national healthcare reform. Unfortunately, the policy initiative to provide healthcare to millions failed to even get a vote in either chamber of Congress. President Barack Obama was elected in part due to his commitment to healthcare reform. The Affordable Care Act, ACA, formerly called the Patient Protection and Affordable Care Act, but also called Obamacare, was signed into law March 23, 2010. The ACA included the following provisions: subsidized premiums for people with pre-existing conditions, elimination of lifetime limits on benefits, the option of covering children on parents' insurance until age 26, expansion of Medicaid to individuals under age 65 with incomes up to 133% of federal poverty level. Employers with 50 or more employees must provide health care coverage and premium coverage to individuals. From the creation of the ACA to the year 2015, 16.4 million people who were previously underinsured had coverage and access to care. As the Affordable Care Act expands to cover millions of patients, healthcare jobs are predicted to increase by almost 17% by 2024. The ACA has created changes in the healthcare industry. Since its inception in 2010, the healthcare system's focus began shifting from high-cost medical care to one that promotes healthy living and preventing disease. Professionals in the healthcare industry are being called upon to lead initiatives that promote screenings and early detection of diseases, as well as educating people about health-related behaviors such as nutrition and physical exercise. Healthcare administrators who can explore ways to improve operational efficiency and quality while reducing healthcare costs are in demand. This requires administrators to negotiate, collaborate, and partner in new ways with others in their organization. The Affordable Care Act also provides new mandates for information management and sharing in order to assure that data is available to enhance and encourage change. President Donald Trump promised his supporters that he would repeal and replace Obamacare. He accomplished this by getting a tax reform bill passed in December 2017. The new tax bill will have a significant impact on healthcare organizations and individuals. The tax bill will quicken the deconstruction of the ACA. Healthy individuals may drop out and increase the risk mix of the member pool, which would cause premiums and deductibles to rise. Healthcare policies would then become less affordable. Fewer insured people and high deductibles could lead to more bad debt and charity care for physicians, hospitals, and other healthcare organizations. Also, the tax bill increases federal deficit by approximately $1 trillion over 10 years, which will lead to deficit spending. A federal anti-deficit law in place currently could cause cuts up to $25 billion for Medicare as soon as 2019. In conclusion, healthcare reform will impact all facets of the healthcare industry for many years to come. Most people agree that something needs to be done to rectify the growing costs of healthcare. Determining what reforms need to take place and the best way to accomplish meeting the needs of the American people is not going to be an easy task. Unfortunately, healthcare reform continues to be a divisive partisan issue.